You are standing in a critical care room surrounded by your team that is working on a patient in cardiac arrest. You have been assigned the role of being the medication nurse. The physician then calls out for amiodarone to be given to the patient. Quickly, you look around into the code cart and the medication tray looking for amiodarone. But is it in a pre-filled syringe or a vial? Oh, it's a vial. So wait, how much do I need to draw up, and how fast do I need to give it? Wait, what exactly does amiodarone do again? And why am I giving it? These are all very common questions that new nurses, and some experienced ones, ask themselves in a code situation. Today we are going to talk about amiodarone. This course is for practicing registered nurses in the ER, ICU, or on a code team. At the end of this video course, students will be able to answer all the questions that I just asked above, but more specifically, students will be able to describe the mechanism of action of amiodarone and the relation to cardiac tissue. They will also be able to verbalize at least 4 nursing actions needed to administer amiodarone safely, as well as be able to list 4 common side effects of amiodarone. My name is Jessica Granger, and I am with the University of Texas Arlington School of Nursing. So let's talk about amiodarone. It's one of those drugs you remember that's part of the Advanced Cardiac Life Support algorithm, but do you really know why the American Heart Association has placed it in its recommendations for use in a cardiac arrest event? Before we discuss the specifics of what amiodarone is and what it does, let me give you a little refresher course in how the electrical conduction of the heart works. The heart is made up of different cells that are considered nodal cells, as in the SA or AV node, or non-nodal cells, which are primarily cardiac myocytes and muscle cells. Electrical impulses are what make the heart muscle contract, which leads to the pumping of blood throughout the body. The action potential of non-nodal cells has 5 phases, 0 through 5. In phase 0, sodium channels open, allowing sodium to go into the cell. This is the depolarization of the cell. Following phase 0 is phase 1, where potassium channels open, and you will see a small dip in voltage of the cell as the potassium starts to leave the cell. In phase 2, calcium channels start to open, allowing calcium to enter into the cell as the potassium continues to leave the cell. The calcium and potassium balance of one going in and one going out creates this plateau of voltage within the cardiac myocyte. In phase 3, the cardiac cell rapidly repolarizes as calcium channels start to close, but the potassium channels remain open. In phase 4, that is when the return of the action potential to baseline occurs as the potassium channels close. So why is this important for you to even know? Because many antiarrhythmic drugs work on different ion channels. And depending on what the goal is what the medication is used to order. Amiodarone is an example of this, and it is a class 3 potassium channel blocker that works primarily on non-nodal cells, as is described above. By blocking potassium channels, amiodarone causes the elongated phase 3 of the myocyte action potential. An elongated phase 3 means it takes more time for the electrical activity to depolarize the cell, which means a longer time between heartbeats. It slows the heart down. Amiodarone is most commonly used to treat ventricular tachycardias and ventricular fibrillation, though it can be used to treat SVT and other atrial issues. By prolonging the action potential of the cardiac muscle, amiodarone slows the heart down and works as a chemical defibrillator in a patient with pulseless VTach and VFib. It is not indicated on an asystole or PEA in the same way that manual defibrillation is not indicated in cardiac arrest. According to ACLS, the first dose of amiodarone is 300 milligrams rapidly pushed through an IV. which may be repeated in a second dose of 150 milligrams after 3 to 5 minutes. Amiodarone comes in the concentration of 50 milligrams per ml, and since there are different dosages depending on if it's the first dose or second, it will not be in a pre-filled syringe and you will have to draw it up manually. Nursing considerations including establishing a peripheral IV, monitoring ECG continuously for rhythm changes, as well as vital signs, as amiodarone can cause hypotension. Other common side effects include pulmonary toxicity, so monitor patients for rales, crackles, breath sounds, and their pulse ox saturation. Long-term oral use of amiodarone, not in the ACLS algorithm, can lead to thyroid dysfunction as amiodarone is chemically similar to thyroxine and may bind to thyroid receptors. On a side note, the phase 3 of the action potential equates to the QT interval on an EKG. One of the possible side effects of administering amiodarone is a prolonged QT interval, which can lead to a condition known as torsades, and that can then further turn into VFib, and we don't want that to happen. Amiodarone is contraindicated in sinus nodal bradycardias, second and third degree blocks without an artificial pacemaker. Because you have to remember, one of the side effects is slowing down the electrical conduction of the heart, and we don't want to give someone with already a slow heart rate to begin with amiodarone. Amiodarone is a powerful class 3 antiarrhythmic drug that can be used to slow electrical activity of the heart by blocking potassium channels and prolonging phase 3 of the myocyte's action potential. During a code, nurses do not have the time to look up information on drugs that they're giving, and they need to be familiar with the mechanism of action, dosing, and nursing considerations beforehand so that they're able to safely care for patients during these very time-sensitive situations. After this video, you will have the opportunity to ask any questions for clarification before you take a short quiz to test your knowledge. My name is Jessica Granger, and I'm with the University of Texas Arlington School of Nursing. Happy learning!